Hi, welcome to week 4, more front-end analysis. We are in the thick of front-end analysis for your individual instructional design project. But you've gotten some practice with the front-end analysis skills at the Hellgate Learning Management Scenario System, as well as the social media profile marketing scenario. The textbook makes a distinction between a needs assessment and a goal analysis. The Hellgate LMS scenario falls more into the needs assessment category because it is involved in extensive attention to proving the need and collecting data to prove the need. The social media scenario might be considered more of a goal analysis because the scenario starts with more of an assumption that a need is clearly present, and the analysis must focus more on identifying what goals need to be identified for that need. I'll be using a point A to a point B framework throughout this semester. In all design tasks, a user, and in our case this is a learner, is on a path from point A to point B, and that path is facilitated by our design. Point A represents where the learner is at prior to any intervention. Point B is where the learner needs to be. It is the desired outcome, and it represents the results of the needs assessment and the goal analysis, or both. As designers, we spend a lot of time on the gap between point A, the start of any intervention, and point B, the use of the intervention. We try to learn what the gap is based on, and then we come up with the intervention that bridges the gap. Needs assessments are also called gap analysis because designers are trying to figure out what needs to be done to fill the gap. You may also hear the term cause analysis to refer to the same thing. At this point in the semester, your head is probably swimming with all of the professional words. Because of the many names and acronyms, it's going to help you to back up and look at instructional design with this very simple model. I like to call these the variables of instructional design. Each one varies from known to unknown, single to complex, predictable to unpredictable, and so on. Because they are variable, they interact. There are many ways for a designer to design. For example, sometimes variable B is a given, as in state standards and public school education. With that part of the equation determined, the designer can then focus on how the other variables are going to impact the analysis. Sometimes variable B is a complete mystery, and few people know what it is. As an instructional designer, I worked in settings where years went into determining point B, and also in settings where nobody had a clue what point B was supposed to be, other than a fuzzy goal that nobody understood. Believe me, in settings like the latter, the more structure you have to hang on to, the better. Just knowing that there are expressed needs, felt needs, anticipated needs, point A's and point B's will give you some grounding and give you a good place to start. And remember, the path between point A and point B is never straight. Design is a messy process. It's all about creating order. Instructional design is an art and it's a science. With every chapter in the textbook and with all of the activities in which you participate, you will be gaining quite a few design skills and tools. The case studies, the ID projects and their rubrics, the instructional design textbook example that's at the back of the textbook, Dr. Kinzie's health education example up next, and of course your own instructional design project. Let's take a look now at Dr. Kinzie's diabetes education example.
I thought it would be useful to walk you through this process for a project of my own done several years ago for diabetes education. This was a project that I undertook with faculty at the School of Medicine, and we were funded by the Robert Wood Johnson Foundation. As I walk you through, I'll describe the needs statements, the information we gathered that helped us know that these were learning needs, and the critical issues that attach to each. I'll tell you more about the target population when we get to learner analysis. But to begin with, one of the most important needs for individuals who have type 2 diabetes is to recognize the patterns between their blood glucose and their adherence to the medication prescribed, the dietary program, and the program of exercise that had been articulated with their participation by their healthcare provider. How did we know this was a learning need? Through the needs data we collected in the needs assessment. We used both interviews and surveys of patients and various healthcare providers, physicians, nurse educators, diabetes ed specialists, and so on. And through these multiple sources of information, we were able to determine that patients, in fact, did not know how to describe connections between these influential factors, and they weren't able to recognize the connections of these factors in their own self-care and their own health. There were several critical issues that were important for us to acknowledge. First of all, there is significant variability in how diabetes manifests, and this contributes to the difficulty patients were having in recognizing the patterns. Second, diabetes self-care involves some significant lifestyle changes, particularly involving dietary change and implementation of an exercise program, and these are sometimes difficult to enact. I'll stop here and remind you to check your needs statements to make sure that what you're describing are truly needs and not solutions that you might implement to meet the needs. Here's an example. A need would be patients will understand the patterns between blood glucose and medication adherence, diet, and exercise. A solution would be patients need a website providing diabetes education on patterns between blood glucose, medication adherence, diet, and exercise. I'll move relatively quickly through the next three needs. We determined these were subordinate in importance and beyond the scope of our project funding, but I want to give you an example of some additional needs for this project. The second need we identified was for patients to be able to plan healthy menus. This is again based on interviews and surveys of both patients and care providers. We determined patients were not able to describe the characteristics of healthy menus or how to adapt recipes so they would be more healthy, and how to plan healthy menus. Critical issues for us to acknowledge and to address. Oftentimes, families were not on board with dietary changes. That healthy meal preparation sometimes takes more time, and that lifestyle changes are difficult to enact. The third need, patients should be able to manage stress associated with diabetes. We found that patients possess very few stress management skills and strategies, and had little experience with the positive effects that these can have on their levels of stress. Critical issues? Well, back to diabetes being a difficult disease to manage, that adds to stress, and that management requires lifestyle changes, and lifestyle changes are often difficult to enact. The fourth need was for patients to be able to support one another, other patients who also are struggling with the challenges of living with diabetes. We found that patients meet day-to-day challenges largely on their own and experience feelings of isolation, but aren't certain how they might support others. A critical issue for us to acknowledge there was the importance of building patient peer support networks, but only after pattern recognition has been achieved for individual patients. In other words, they need to be able to manage their own diabetes before they can usefully support others. On the next couple of slides, I'll show you our goal analysis and leave you a second or two to read through on your own. You've probably been wondering about the target population we served, so here are the details in our learner analysis. Adults, more female than male, 40% minority, and most of these were African American individuals. And it's a low-income population with 70% qualifying for discounted patient care and 40% medically indigent with no health care insurance. Among the specific entry characteristics were three. They needed to have been diagnosed with type 2 diabetes at least 6 months previously. They needed to show evidence of an elevated glucose level, and we needed to exclude patients with other problems since we needed to be very clear that we were focusing only on diabetes management. In terms of academic information, 25% had an 8th grade education or less, and 36% had not completed high school. Among the personal and social characteristics not already addressed, we knew that food and eating were culturally important for our target population, and that they valued a high-touch approach from their healthcare providers. On to context analysis, beginning with orienting context, the space from which our learners are operating. 79% of them expressed an interest in participating in a web-based self-care program. That's what we had been funded to create, and had a lack of knowledge about diabetes and its implications. But there were some tricky issues surrounding their perceptions of personal accountability for health. They reported previous interactions with healthcare providers and systems as sometimes less than optimal. On to consideration of the instructional environment, and this meant consideration of the home. 99% of patients had televisions in their homes, sometimes quite large televisions. 96% had landline telephones. This was before the advent of cell phone usage. And 27% had computers. So not very many of them had computers, but most of them had televisions and landline phones. That meant a web TV interface was possible with that existing technology. For transfer context, we knew that the instructional intervention must be easily and quickly implemented in the context of busy day-to-day lives. And we knew the intervention needed to be integrated into the patient's care if it were to be effective, not a separate add-on. I hope that seeing this single example of a needs assessment, analysis of goal, learners, and context has been helpful to you, and we really look forward to seeing the results of your efforts.
The takeaways that I hope have transferred from this lesson include front-end analysis does not follow a set path. Sometimes you do a thorough needs assessment, sometimes you don't. Front-end analysis can feel messy. The path between point A and point B is seldom a straight one. Stepping back and thinking about point A and point B variables can help you gain confidence in your ability. Where is the learner at? Where do they need to be? What is the gap between those two? You have many examples to follow over the semester. And that's all that I have for this week. Good luck. See you next week.